we realised that within Bedfordshire Community Health Services, we had a really low number of service users and carers that were actually signed up and actively doing participation work to develop services. This is obviously really disappointing. We had a number of ideas why that might be, you know, COVID obviously being one of them. But we looked to other directorates and they were still managing to have their numbers quite high. So we thought it was a perfect quality issue to explore. The big post-its that you can see in the middle are actually what came to be our main drivers. We came to know what the drivers were, the essential things we needed to achieve our aim, just through discussion again. We made sure we collected everyone's comments. We themed what everyone, I simply asked the question, why don't you think there are a lot of people, a lot of patients or carers in your services that are signed up to do participation work? Why don't you think we have many people? And we then themed these and were able to come up with our 5 main drivers. And the only point I want to get across here is that I think it was quite clear that had we not had a patient on the project team, if we'd not had a service user there, we probably would not have identified stigma as one of our primary drivers. This next tool to really help us visualise and get all the issues on the table on one page so we could see what we meant and what we thought the issues were under each driver. So this, for example, is all about our primary driver of time. A member of staff clearly felt they didn't have the time to talk about participation with prospective service users and carers that they were seeing. They asked why did they feel they didn't have the time. It's not seen as something to prioritise, or at least they're not told that it's something to prioritise. And they asked themselves why, and they thought, well, actually, perhaps it's because there isn't much of an understanding of participation within our teams and just how it can help patients. They asked themselves why again, and they felt, well, actually, simply we've not had enough exposure and we haven't had people talk to us about PP enough. And then they came to the conclusion that there's just not enough bespoke training on participation for our particular team. And what we did with those, as a team, we kind of did a priority matrix and we thought, hang on, which ones are feasible and which ones are most important to us as a team? And that allowed us to finally get to our driver diagram, which I think has been one of the most useful tools for everyone in the team throughout this project. Everyone can see these change ideas that we're going to focus on in the green. And we identified kind of 6 main ideas we wanted to take forward and test out. You can see in front of you one of our charts. It's our kind of main outcome measure. This kind of measures the number of people that we have signed up to PP from Bedfordshire Community Health Services. You can see from when the project was launched back in September, and this goes up to May currently. You can see just most notably just the points at which the line obviously increases at a rate. So that jump was actually as a result of the second change idea that we tested, and that's the one I'm going to just speak to you about briefly now. So that change idea was actually what we've called our clinic conversation. Very simply, it was a clinician in podiatry agreed to go away in one of her clinic days across 1 week and ask all the patients that she saw in that clinic day a tiny bit about people participation. So she had about a 2-minute conversation with the patient at the end of the appointment, explained what people participation was, and then asked the question and gave the offer, would you like to find out more? At which point they either said yes or no. So what we found after we ran that, 8 people on that clinic day were seen and were spoken to by the clinician about participation, and 4 of them, so that half the patients she saw were interested in finding out more. It took a couple of minutes, and it was 1 member of staff in 1 team across 1 day, so 1 clinic day. So really be simple to replicate that. We could see the potential to replicate that on a rota across all teams within Bedfordshire Community Health Services. So we have got 3 of the other services shortly to run this test, not at the same time. They're going to go staggered a week after each other. I hope that's given you a bit of a flavour about how we've gone about the project. I think for me, it's about having a passion about something, about the quality issue that you're investigating and trying to improve. So obviously I'm a participation lead, so I'm all about, you know, making sure services are involving their patients and carers.